Dr. Sonto from the University of Venda of South Africa. She will chair the following session, and she will also give us the first presentation of this session. Welcome to Beijing. Please, could you give your talk? Thank you very much for being there.
Okay, good morning. I'm going to present the study specifically focusing on socio-cultural aspect. I know that since the morning we listened to the evidence-based, we listened to the presentation on that organogenesis that was presented, but mine will a bit deviate from that. It's traditional medicine and pregnancy management, the perception of traditional health practitioners. This study was done in one of the districts in Limpopo province. So the introduction, we know that pregnancy is not just focusing on medical aspect, but it also reflects the cultural aspect of that woman and the family. Because now we know that it might be in South Africa, it might be in all other countries. The traditional medicine are deeply woven in cultural and spiritual beliefs. So in this context, the traditional medicine during pregnancy is being used because it is believed that when these are used, it prevents abortions, or it prevents miscarriages. It ensures the proper growth of the fetus. It further ensures the stability of that woman during pregnancy, because it is thought that it also strengthens the womb against the witchcraft. I'm putting this as the traditional healers were putting it. And it also prevents some of the childhood illnesses. That is a very good intention, because if we believe in that taking the traditional medicine will bring all this, we know that the woman and the baby will be protected during that pregnancy. And then at the later stage, it was found that the taking of traditional medicine, it ensures that the placenta is being delivered without any difficulty, and the woman will not experience complications during delivery or even post-delivery. So those are good intentions. And then this study was done in Limpopo province, and this is South Africa. The study was done in this province, Limpopo province, in one of the districts there. What we observed, it was that in the labor units, registered midwife will record negative effects from the women who took traditional medicine especially when they started labor. Because now, when we find that the woman will be in labor, those women who come with precipitate labor, immediately the labor becomes so short and quick, very, 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 very strong contractions or incoordinate uterine action. The woman will take very prolonged labor. She doesn't deliver, or some of them will experience a uterine rupture or any fetal distress. When they take thorough history, those were the women that were found that they are having that history of taking traditional medicine. So although not necessarily that all the women, but the higher percentages was found to have that. So now that's why we were interested to find that how do the traditional health practitioners treat the pregnant women when they consult them. So that is why we're saying we wanted to find out how do they perceive management, because as I've indicated that the intention is very, very good, because as we believe in that, it was very good for the women. Then we did the qualitative exploratory research study where we did a non-probability sampling, we did a snowballing, because those traditional practitioners were the one that were referring us to other one and the like. So finally we got 8 of them. We collected data that was unstructured face-to-face. And then the central question we were asking them, how do you manage the pregnant women with the traditional medicine? So then we got the information, we did open coding analysis. So the results we had that now, because now we're classifying where they were indicating how do they treat them during the first trimester, second trimester, and third trimester, where we are going to see that generally they indicated that when women are pregnant, the woman is weak and the woman is vulnerable to bad air. I'm putting this as they were mentioning that, and this is very dangerous to the baby, so the woman needs to be strengthened. And some of the management that you'll find that they will indicate that they put some herbs and then even tying around the waist of the woman when she's pregnant, that will strengthen that woman. That bad air will not come to the woman. And then again, what was another thing is that they mentioned that when the woman, if the woman is pregnant, having that protection, the woman must not share the information with others because they might be bewitched and lose the pregnancy. So those were some of the things. But what we saw that is lacking, they were lacking information or knowledge on the effects of hormones during pregnancy, because some of those effects of hormones and the minor disorders due to the hormones were interpreted to them as these are some of the things that are not supposed to be there. So, but generally for protecting, they were putting the tying of that around the waist, where they put those some of the herbs, because they were having different herbs for those treatment. And then they were tying, these were some of the treatments that they were giving. But when we were looking at that, these are some of the herbs or the trees, they were taking them, then they were tying on that. And then for nausea and vomiting, they were using a ginger herb, because now they knew that the woman might have this problem, then they were giving that. And then during the second trimester also, I think it doesn't differ much from the first trimester, because they were protecting or they were preventing the evil spirit. Basically, these were some of the herbs that they were giving this woman to drink. Because what we observe again, if they give anything to tie, that wasn't having more problem. But maybe the problem was coming now when they give something to drink, because again they were not having the knowledge on the pharmacodynamics or pharmacokinetic that happens exactly during pregnancy. So that was also the problem, because most of the problems that these women were presenting to them were physiological changes. So during the last trimester, we find that now we know that physiologically the breast is going to excrete colostrum. So to them, that was also not a normal thing to happen, to an extent that at times they will cut small incision on the breast, and that woman is about to deliver. And at times, to us, it was a problem, because if now they don't know especially the HIV status of this woman, immediately that woman, when she delivers, that will be the challenge, putting the baby at risk. So those were some of the other challenges that we had during that period. During labor, they were giving some of the drugs. Some of them, they called it kukuku, I don't know in English, but that they were thinking that it losing the mother's flesh to open the hip. That is how they were putting it. So again, they were encouraging most of these women to engage in sexual intercourse, because they were thinking that they opened the baby's, the path of the baby. So that is how they were treating the women. But now, generally, they were saying that the herbs that they are giving, they are cleaning the womb, and then they also induce labor, protect the child, and then they also assist the sicknesses and discomfort and pain, and this woman will feel very secured, because if you believe it's true, you'll feel very secured. So basically what we observed here is that the traditional health practitioners, yes, they do have the herbs that they give to women, but they lacked information on what physiological changes that take place during pregnancy. Again, they were lacking the pharmacological actions or pharmacokinetics of some of the medicine that they were giving, and even maybe the measurements, which we thought now that the health education and promotion is very important. Again, the session need to be conducted with them, again, to empower them, that some, especially those that were drinking, they were given to women for drink, those might pose potential risk to the baby. Then integration of this traditional medicine into maternal health care services, that was a very, very strong thing that we needed to advocate for. So I thank you.
Thank you for your speech. It's a good treatment with the traditional medicine during the period of progress. And as the traditional medicine is complex with the compound, so how to ensure the safety use of traditional medicine? And are there any classification of the safety of traditional medicine?
Thank you. What I will say is that remember that we observe those from the labor unit. Then we tried to identify these traditional health practitioners. Yes, they belong to the association. But now when we were going there, we find that it's not that regulated per se, and their medication, yes, they are there, they know them. You'll ask that, what is this for? They will tell you that this is for what, but it's not written. So we're even not sure whether is it safe. That's why we said that maybe we needed the session with them, so that's I think yesterday there was a talk from South Africa that they needed to strengthen the integration of traditional medicine into the health system. I think once it's clearly strengthened, that will avoid what we are presenting here, because they will be regulated and exactly known that what treatment is being given to these pregnant women.
Excuse me. Very nice presentation from you. May I have certain information regarding the institutions of traditional medicine in South Africa and the legislations which allow and permit to practice this traditional medicine in South Africa?
Okay, I will request my colleague to assist in this aspect. Mamat.
I've been doing this research from 1997 about traditional healers and traditional medicines. I started looking at the relationship between the traditional healer and the patient. And after that, I looked at the therapeutic techniques that they are using. The various therapeutic techniques that the traditional healers are using in South Africa are also inclusive in part with acupuncture. Now, there is an act that has been gazetted in South Africa. It's called the Traditional Health Practitioners Bill. It is now an Act of Parliament of 2004 that recognizes the existence of the traditional healers in the country. However, it does not give them the due recognition to act and to practice in healthcare settings, like in clinics and also in hospitals. The other thing that is also, I'm a biomedical person, she is a biomedical person, and as biomedical people, we are slightly skeptic. I'm presenting my paper this afternoon about the traditional healers, medicines, the herbal concoctions or decoctions, as we like calling them. But the miraculous part is, when these people call you and they show you the people that they have healed, you become astounded. What do you say? As the Prof said yesterday when we introduced, that I was just an ordinary doctor, and if someone comes with something like this, what do I say? So that is why in South Africa right now there is a resolution, the Act of 2004, and it is stipulated what they are supposed to do, how they are supposed to organize themselves as small organizations in provinces as well as the major one. So right now, with my other research, I'm going further into what is it that makes us, as biomedical people, remain so skeptic about what these people are doing, but these people are healing the people. And 90% of the people in South Africa are using traditional healers.
Okay, thank you very much. So far, that means there is no educational institution to train the physicians of traditional medicine.
Right now, I'm one of the proponents of teaching the traditional healers simple biomedical procedures. So in teaching them simple biomedical procedures, we are also trying to teach them also that when you give the patient a medicine, as it is done in the hospital, you must know that that medicine can have adverse effects, it can have toxicity, in as much as somehow it can also affect a cure. That is what we are trying right now. It is on a small scale, but we are looking at it going across the provinces that are 9 in South Africa.
But also to add to what Professor was saying, just an answer your questions, there are no formalized training programs or institutions in South Africa at the moment that focus on traditional healing. So a lot of the time is passed on from father to son, father to daughter, hereditary format like that. So it's indigenous knowledge systems that are passed on from generation to generation. And often you do find those spiritual healers that have to then undergo a traditional initiation process, where you will get trained in the various medicines that you will need to know in order to heal people.
But as far as my knowledge is concerned, we are having a chair in Unani medicine in the University of Cape, and another one in Ayurvedic chair is also there in South Africa. You can do interaction with these two chairs and can be benefited from well-organized educational patterns of this traditional medicine. Our two experts are already there in South Africa. Professor Mushtaq Ahmad and one from Ayurveda is also there. You can get benefit from them.
No, I suppose you're right. I think, I say where we come from. I come from a financial institution, so we call it the Industrial Development Corporation, and we look at funding projects in traditional medicine. That's why we partner with
because the Department of Ayush, Government of India is very much generous to provide the technical know-how and logistic support to develop these traditional medicine, and without taking any single pies from the South Africa, we are providing the support to them.
Not only that,
Can I say, with due respect to everyone, when I make my presentation in the afternoon, we will be able to deliberate on all this. We have the Medical Science Research Council in South Africa. We have the University of Cape Town, the University of KwaZulu-Natal, the University of Pretoria. One of my colleagues is from the Free State, is that side. The University of the Free State. They are all working together to look at how the traditional medicines can be tested scientifically and which ones can be put in a pharmacopoeia for traditional medicines for the South African people.
Oh, that's nice, but my part is that you can take benefit from our people who are working over there, and already they are running the graduate level course in University of Cape of traditional medicine. Yes, Cape Town. Yeah.
Thank you.
What I wanted to say is there is a very significant difference between two things. One is healers and one is practitioner of medicine. And as far as my knowledge is concerned, there exists an African system of medicine and there is a system of healers. Healers are usually faith healers, like you said, that passes from one generation to the other, but lacks a scientific module onto it. So instead of that, I would agree to Dr. Sharik that probably you need to look at the other facet, which is organized setup and organized structure of medicine, which you yourself have. The African culture has its own system of medicine, which is very much, it gives references, and they are quoted references in our education module also. We cover references from all the systems of medicine in our course of study, and we find those references.
Thank you. We can continue this in the afternoon. Thank you, sir.
To give you this certificate.